Assalamu alaikum and welcome to the first match of Cardiometabolic Premier League presented by PSIM and PHL, brought to you by Wilson Pharmaceutical. In this battle of brains, we have total 36 teams which will be competing with one another, and today's match is between Aga Khan University Hospital Titans and Jinnah Hospital Dominators. Or it's time for introduction. We are blessed with the kind presence of so many graceful personalities. These includes council members, umpires, and guest panelists. I will name them one by one. Professor Ishaq Saab, he is Professor of Cardiology at KIHD Karachi. Second, we have with us Professor Azizur Rahman Saab. He is Professor of Medicine and Senior Vice President of PSIM Lahore. Along with him, Professor Tasawwur Hussain Saab, he has also joined and he will be serving as an umpire of today's match. Professor Tariq Wasim Saab has also joined. He is Governing Council Member of Cardiometabolic Premier League. Professor Kashif Ali Hashmi Saab has also joined. He is PHL President and currently in Cardiometabolic Premier League he is Governing Council Member. Last but not the least, today's session moderator is Dr. Hamza Azhar Ghori Saab, who has been instrumental in our previous Cardiac Super League. Dr. Hamza Azhar Ghori Saab, he is Assistant Professor, RIC Consultant Interventional Cardiologist and Certified Stroke Interventionist. For further moderation, I am handing over the mic to Dr. Hamza Azhar Ghori Saab.
Thank you very much, Usman. So we are back again with another league after the success of Pakistan Cardiac Super League. Now we have our first season of Cardiometabolic Premier League, which is brought to you by Wilson's Pharmaceuticals, of course, in collaboration with Pakistan Society of Internal Medicine and Pakistan Hypertension League. So as we all know, we are going to kickstart this league with the first match. But before we move on to the match and how it's done, I'm quickly going to welcome our esteemed faculty members, our council members for today, and we know that it's Professor Ishaq Saab who's with us. He's the Patron-in-Chief for the league. We also have other governing members, Professor Kashif Ali Hashmi Saab, he's there with us. We have Associate Professor Dr. Matiullah Saab. Welcome, sir. Welcome to the league. We also have Professor Tariq Wasim Saab. And I think as we have more council members joining in, we will have the introductions. So with this, we also have to include our umpires for the game, who are always extremely important and are the pillars of the game, and we never know when we may need them. So for today's match, we have Professor Azizur Rahman Sahab. He's with us as the umpire. Welcome, sir. And we also have Professor Major General Tasawwur Hussain Sahab. So welcome, sir, as umpires for today's match. So it's great to have all of you today. And we all know the format. So for you who have joined us in this season, I would like to explain that both the teams are going to be posed with 10 questions apiece. For every right answer, they'll get a score of 6. And we are hoping for 6 as always. For every wrong answer, they'll get a score of 0. In the end, whosoever scores more is going to win the battle. And remember, right from the outset, most of the matches, in fact, all of the matches are going to be knockouts. So you've got to be very careful. There is a lot to play for. Now, the two teams which are up against each other. So we have from Lahore, and yes, we have Jinnah Hospital, Dominators, and they are going to be up against Aga Khan University Hospital, Titans. So welcome, and we are hoping for a good game. So with this, I think I'm now going to move to the two teams. And can we have them on the screen, please? All right, so we did have a technical glitch. We apologize on behalf of the whole team because we had some technical problem going on in Lahore. So I think I'll ask Aga Khan University Hospital and the team captain to start with the introduction of the team.
Dr. Sadi Ahmed, captain from Jinnah Hospital.
And the rest of the team, please.
My name is
Name them,
Dr.
please.
Samra Khalid.
My name is Dr. Fatima Sakhawi.
Dr. Rasha Masood.
All right, so welcome to the show Titans. We are looking for a high scoring game as we have kick-started this league. Okay, right. So Aga Khan University, I think that was Jinnah. Dominators, yes, they were having some technical issues, so now I think that has been resolved and we can see them. Can we have Aga Khan on board? Titans? So Aga Khan, can you hear me now?
Yes, we can hear you.
Okay, that's great. Great to have you, Aga Khan team. I'll ask the captain to quickly give the introduction of the team.
Okay, sorry for the delays. I am Dr. Rahila here, leading AQS Titans, and with me I have Dr. Fatma and Dr. Zainab.
All right, so it's great to have you on the show and this Premier League. So I'm quickly going to move to the toss. So can we have the electronic coin toss? All right, so I'm going to randomly ask one of the teams. Aga Khan, I'll ask you to call either heads or tails. What is it
Heads.
going to be? Heads? Is it heads?
I think that
All right, so roll the coin. And it's a heads. All right, that's a good start. You didn't start off that well, but I think the coin has gone in your favor. The toss has gone in your favor. And I'm going to ask you two questions now. Aga Khan, the first one is, do you want to take the questions or you want to throw the questions?
we will throw the questions first.
Okay, you want to throw the questions. And now with the second question. You will have two scenarios, two veneers in front of you. Case A, case B. Which one do you want to pick?
Case B,
Which one? Say it again. B?
yes, case B, B for
All
boy.
right. So the news from the center is Aga Khan has won the toss and they want to throw the questions and they have selected case B. That's great. And we all know the conditions, murky conditions, but I think the pitch seems to be pretty good and I'm hoping for a high scoring match today. All right. So do we have the blessings from the council members to start the first innings? Sir, should we?
Yes, please go ahead. And
Thank you
if
very
can
much.
Increase the volume, that'll be fine.
Right, sir. I'll convey that to them. Please increase the volume and thank you for your patience. And can we have the first scenario on the screen? And I will request the throwing team, which is Aga Khan, to read the scenario, please.
56-year-old male with diabetes and hypertension developed right-sided weakness of arm and leg for last 2 hours. Pulse is 87 per minute. Blood pressure is 180 by 110 millimeters per mercury.
All right, so that's the scenario. Now I'm going to ask Lahore Dominators. Are you ready for the question?
Yes.
All right, they seem to be ready. Well done. Can we have the first question on the screen now? Okay, Titans, read the question and the options.
A CT brain shows no bleed. What is the best treatment for him? A. Aspirin 300 mg. B. Clopidogrel 300 mg. C. Thrombolysis with streptokinase. D. Thrombolysis with TPA. E. Anticoagulation with heparin.
And your timer starts now. You have 60 seconds. Dominators, you can take a look at the scenario whenever you want. And I will request Dominators to keep the mic
Option
open.
D, thrombolysis with TPA.
Okay. Which option? Option
Option D,
D for Delta,
Delta.
that is. Okay. So you've come down the wicket. You're trying to hit it for a 6 over long on boundary. Ishaq Saab won't be happy, I know, because you've come down the wicket. He always tells everyone to take your time and be focused and be vigilant. The time is at your dispense. So we have option D, Delta. Lock it, please. And yes, after a delay, it's a wonderful start. So we are on board. 6 runs. Well done. Very well done. So that's the kind of start we needed. All right. Question number 2. On your screen now. Read it, please.
What is management of his blood pressure? Lower BP by 25% in 1 to 2 hours.
Yes, please read all the options.
Lower BP. It's zoomed out. Sorry, we're trying to figure out.
Okay. Can't you see the options? You just have to read the options.
Yes, can't see the options right now. They are blurred, but we are trying to sort this out.
Okay, so I'm going to read it out. What is the management of his blood pressure? Option A, lower the BP by 25% in 1 to 2 hours. Lower the blood pressure 10 to 15% in 6 hours. Lower the blood pressure to 10 to 15% in 12 hours. Lower the BP to 10 to 15% in 24 hours. And option E, no need to lower the BP at all. Yes. Your 60 seconds start now.
Option E. No need to lower the BP.
Okay, that was pretty quick. I think you were ready for the stroke. You don't want to utilize 60 seconds. You're sure enough? You want me to lock it? E epsilon?
G log. G log.
Okay, वो कह रहे हैं G lock. So then lock E epsilon. Oh! You missed it. That's the wrong answer. The right answer was option D. Lower the blood pressure to 10 to 15% in 24 hours. I think Ishaq Saab, he's always there to guide you. Take your time. Utilize the time. Okay, moving on to question number 3. Titans, read it please.
Keeping in view his weakness of right arm and right leg with low sensory involvement, which artery is involved? A. MCA, B. ACA, C. Branch of middle cerebral artery, D. Small perforating arteries, E. Posterior cerebral artery.
And 60 seconds, start now. Come on, Lahore. We need a 6 from you this time. Approaching 25 seconds. 20 seconds. 15, come on.
Middle cerebral artery.
Are you
Middle
sure?
cerebral artery. Alpha.
Okay, you want me to lock A alpha, middle cerebral artery. Lock it. Oh, that's another miss. That was an in-dipper hitting your pads. You missed it. Never mind, never mind. You still have 7 more questions. You have to be a bit more careful. Question number 4 on your screen.
What would be the best choice of drugs for a patient with ischemic stroke? Aspirin 75 mg, clopidogrel 75 mg, medium intensity lipids lowering drug. Option B, aspirin 300 mg, high intensity lipid lowering drug. Option C, aspirin 300 mg only. Option D, clopidogrel 75 mg, medium intensity lipid lowering drug. Option E, aspirin 75 mg, clopidogrel 75 mg, low intensity lipid lowering drug.
And your timer starts now, 60 seconds.
High intensity.
High intensity.
So I would like to take this opportunity to welcome Professor Mohammad Tariq, who is the Dean of Aga Khan University Hospital. Welcome, sir.
Option B.
Okay, I'm hearing
Aspirin
something.
300 or high density lipid lowering drugs.
B
Girls,
beta.
take your time, discuss, and then come up with an answer. Don't jump.
Yes. Ishaq Saab is there. He's telling you not to get hasty. Take your time. He wants you to score well. Are you sure you want me to lock beta? B option? Come on, 10 seconds now.
Option B.
Okay, option B beta. Right. So lock option B beta then. Yes! That's a 6. Well done. A much needed boundary. Well done. And that's over extra cover. Very well played. They were convinced. And Ishaq Saab really wanted them to score. And we all did. Well done. With this, you have 2 correct answers. A score of 12 in 4 questions. Can we have the next question? Question number 5.
What is the significance of aspirin in ischemic stroke? Option A reduces in-hospital mortality. Option B prevents infarct extension. Option C reduces risk of early stroke recurrence. Option D improves cerebral perfusion. Option E reduces risk of cerebral edema.
60 seconds are on your screen. So I would also like to welcome Associate Professor Dr. Shabnam Naveed. She's with us. Welcome, ma'am.
Beta. Prevent infarct extension.
Okay. Are you sure?
Beta option.
Okay, they are saying beta option B. All right. We have heard
Yes.
you. Lock B beta. Oh, as confident as you were. That's another blemish. Okay. All right.
क्या था? चलो.
Okay, chalo, koi baat nahi. We still have 5 more questions to go. Can we have question number 6 on the screen, please?
Which territory is involved in patients with marked weakness in left leg along with sensory loss and global aphasia? Right, options are option A, right anterior cerebral artery, B, left middle cerebral artery, C, right middle cerebral artery, D, basilar artery, E, vertebral artery.
And the timer is on your screen. Come on, Aga Khan. Come on, Lahore.
Right
25
interior
seconds.
cerebral artery.
Okay,
Alpha
which one?
option.
Alpha option, right anterior cerebral artery. A alpha, right? Okay.
G.
We are going to lock A alpha. Lock it. Oh, that's another miss. It was the right middle cerebral artery, option C. Okay, okay. Jinnah, Dominators. You need to dominate from here on now in the next 4 questions. Come on, play it smartly. Focus. Can we have question number 7 on the screen, please? Read the question. Aga Khan. Titans, read the question, please.
In a middle cerebral artery stroke, clinical deterioration secondary to malignant MCA syndrome is due to which mechanism? A. Reinfarction. B. Hemorrhagic transformation of infarct. C. Infarct extension. D. Cerebral edema. E. Involvement of respiratory center.
And the timer starts now. And I would request Jinnah, Dominators, to keep their mics unmuted because we want to hear you talking. B. Beta, hemorrhagic transformation of the infarct. Is that the one you want? Come on, which one? B option?
Yes.
Which option? Okay, lock B. Option B. Oh no. Another wrong answer. So just like the technical issues, I think there are blemishes in the answers also. They got it wrong as well. Okay. You still have 3 more questions now. Dominators, dominate those 3 questions. Come on, you can do it. Question number 8 on your screen. Read the question, Titans.
What is the definitive treatment for malignant MCA syndrome? A. Anticoagulation. B. Mechanical thrombectomy. C. Early decompressive hemicraniectomy. D. Antiplatelet drugs. And E. Steroids.
Right, your timer starts now. 60 seconds. Jinnah, Dominators, can you hear us? Okay, start the timer. Jinnah, 30 seconds to go. Hurry up. 20 seconds. 15, come on. 10 seconds now.
Option C.
Option C. So they want us to lock option C, early decompressive hemicraniectomy. All right, lock option C, Charlie, then. Yes, that's a 6. Well done. It's been flicked for a 6. Very, very well done. We were all hoping for a 6 and we've got one finally. Well done. Well done, Jinnah. You still have 2 more questions and you can post a competitive total. All right.
That was a tricky one as well, Hamza.
Yes, sir. Very tricky. I was not expecting, but then suddenly they come up with this 6. So well done. All right. I'll request everyone else to keep the mics muted, please. We are going to have the second last question of the innings. Question number 9. Can we have it on the screen?
What is the initial imaging modality of choice in suspected ischemic stroke? Option A. MRI with diffusion weighted imaging. Option B. CT brain without contrast. Option C. CT brain with contrast. Option D. Carotid Doppler ultrasound. Option E. MR angiogram.
You have 60 seconds now. Dominators, come on.
वही है उसमें आराम से सोच अभी तुम बोल
30 seconds. $25. Which option? 15 seconds to go.
Option
Jinnah.
alpha.
Alpha. You want me to lock alpha?
MRI with a diffusion weighted.
Okay. Lock A alpha.
Yes.
Oh. Well. That one was far away from the edge of the bat. You really missed it. by a big margin. Outswinger doing its thing. All right. So you have
The
a score
question
of
was
18.
initial.
So, yes, sir, you can say it again, please. Okay, so we are going to move towards the last question, question number 10. Last question of this innings. Can we have it on the screen?
What laboratory test should be ordered to evaluate underlying risk factors and guide management in acute ischemic stroke? A. CBC, lipid profile and blood glucose levels. B. Blood glucose, renal function tests and clotting profile. C. Lipid profile, liver function tests and echocardiography. D. Renal function tests, D dimer and chest X-ray. E. Electrolytes, thyroid function tests and lumbar puncture.
All right, your 60 seconds start now. Twenty-five seconds to go. Come on, Dominators. We want a 6. A big one this time. 15 seconds. Jinnah, are you there? Unmute the mic, please. Jinnah,
Yes.
answer. 5 seconds.
C.
4, 3, answer.
C.
Okay, now just at the last
C.
moment. Yes, all right. Just at the last moment, it was the last 1 second, and they have picked option C. C, Charlie. Lock option C, Charlie, then. Oh, no. You've missed it again.
Voting profile से क्या होता है?
Okay, so, well, we come to the end of this first innings now, and we have a score of 18. All right. Now I'm going to move towards the dignitaries. First of all, Professor Isaaq, Pattern-in-Chief, sir, your thoughts on the game so far?
Thank you very much. I think the question was quite straightforward and clinical practice related question. I feel a little sorry for the Jinnah Dominators who couldn't score much. It is not a very good score to compete, but that's the way it is. And as I always tell my friends that please take your time, discuss among yourself and come up with an answer. And some of the answers are related to the previous question. So once you have a proper answer of the previous question, the next question has got some relevance to that, and you can easily draw a better conclusion. For example, there was initial. Initial means a very preliminary test, and MRI is not a preliminary test or initial test. So I think if they concentrate on what they have seen before, the previous question, and they've answered, they can correlate and make it more sensible. So that's how people learn, and we learn as well. And I think the phrase, the words are very important. Initial, definite, probable, the only. So you have to concentrate on the word, what the question is asking. And this is what happens in fellowship exam also. We tell them a proper thing. You see, we focus on a particular thing, and they keep coming with different questions. So I think it's very important for anybody to first understand the question. Once you understand the question, the probability is that you will answer it properly. So if you don't understand the question, then I think it becomes difficult. And the wordings are very important. It's all wordings, you see, which matter. So anyhow, well done, whatever they have been able to achieve, but they should keep it up, and there should be no discouragement or losing heart. This is a competition. This is a knowledge which will keep on expanding. And learning is a continuous process till the last moment the doctor is looking, you see. So thank you very much, Hamza.
Right, sir. Thank you very much for your very important words of wisdom. I think they'll be taking a lot of heed from that. And now I will request Professor Tasawwur Hussain. Sir, are you there? Your input, please.
Excuse me, I need to say something.
Please, go ahead.
Yes.
I want to ask the umpire to kindly look into the answers of the question number 10. We are not understanding how that worked
Okay,
out.
okay. So
basically.
I'll request the umpires. I think Professor Tasawwur is there, and we also have Professor Azizur Rahman Saab. Sir, they want to have a review of the question. So I'll request you to come up with your words, and then maybe we'll have a review as per
Can you
the rules.
say the question?
All right. So
I
can
don't
we have?
know if
All right. Can we have the question, please? The question 10. They want to have a review. I think this has been reviewed by the council members, and the umpires are also there. Normally, what we do is this can go into review. You can look into it, and by the end of the program, we can have your thoughts. But if you want to add something, I leave it to the umpires.
Well, I don't know if I have the mandate to change these questions. I think they have been made by a team of experts. So my job is here to see if there's any violation of the rules. That I don't see. There was no ball. Then I don't have to make a decision on the LBW.
Very right,
So
sir.
I
I
don't
think.
know, because any question can be discussed for being valid or not. But I think I leave it to the experts who have coined the question. So
Can I
I
see
Jinnah
the
think
Sahab,
question?
the way
Right. Professor
Jinnah Sahab,
Azizur Rahman Saab, is he there with us? The umpire, the other
Yes,
umpire?
I am, but I want to see the question before I give my reply.
Okay, can we have the question on the screen, please? Yes, sir, you have it on the screen now.
Well, this is definitely a little tricky. This, I think, it is difficult to say for sure that which one is right. All are relevant. For example, the first one could be acceptable. Complete blood count, lipid profile, and blood sugar. I think it will disappear from the screen. That could be taken right also.
So normally what happens is these questions are formed by a panel, then they're reviewed, and then obviously the umpires are there, and they're mostly referenced. So I think we have the verdict from Professor Azizur Rahman Saab. So sir, would you like to give them the score for this?
Can we make this question null and void?
Yes, we can, and then in that case we'll have to move to the next question, the 10th question, and we'll
I
have to
think
ask that
do
question.
that.
All right.
Do that.
So can we have another question in place of this question? We would like to flip the question as the umpires have guided us on this. All right, so Dominators, you will have another question, the last one coming your way. Are you ready for the question?
Yes, we are ready.
Okay, can we have the question 10 on the screen? The replacement question. All right, so Aga Khan Titans, can you read it?
Yes. Which lifestyle modification should be prioritized to reduce the risk of future ischemic events? A. Increasing high density physical activity. B. Adopting a low carbohydrate diet. C. Reducing alcohol intake. D. Smoking cessation. E. Limiting dietary protein intake.
60 seconds on your screen. Best of luck.
बता दो yes रुक जाओ
That's the easy one. They shouldn't miss.
They want to go for the shot, sir, but they are actually listening to you.
smoking cessation E option smoking cessation
Okay, you want me to lock it? D delta?
yes
Okay, lock option D delta. Yes! Very well done, well played. I think this one was a full toss and it's been heaved for a big 6. Well played. So by virtue of this, I think this review went in your favor. Definitely our esteemed umpires were there to guide us. And now you have a score of 24. Well done, well played. Very well done. So with this, I'm going to move back to Professor.
That was a smart move. That was a smart move. And
yes,
thanks to Professor Azizur Rahman for granting this concession.
Very right,
it
sir.
goes
Very
really
right.
to the panel. But lucky.
Very
Good.
right,
I think
sir.
the score looks better now.
It sure does. And I'll request Professor Tasawwur to give his views. He was there with us. Sir, are you there? I'll request, I think
I
he's
would
not
like to
there.
say thanks to the Professor Saab for considering my query. Thank you.
Okay, conveyed. Professor Aziz. Aziz Saab, are you there? Azizur Rahman Saab.
Yeah, yes, I'm here.
Right, sir. So your thoughts on the game so far? The score has gone up to 24 now.
I think I must compliment you for your best comparing. You've done a very professional job.
I'm just trying, sir. I'm basically an interventional cardiologist. They've pushed me into it, got me from the cath lab right into this. That's what they do to me. But I try my best. Thank you so much.
Very good choice for the second job.
Thank you very much, sir. So,
except the technical glitches, everything else was played very perfectly. I think they tried very well, but I think what I see is that they go for the theoretical knowledge more. They probably haven't seen many cases of stroke. They haven't probably managed many cases. Like Professor Sark was mentioning, it clearly says what is the initial investigation of choice for suspected ischemic stroke. I think if they're working, if they're dealing with the stroke patient, this should be on their fingertips. They don't go for MRA or MRI as a first test. They go for the CT scan, plain.
very right, sir. I think these are extremely important points for them. This is part of their training, but I think this has to be inculcated in terms of their theoretical knowledge, and that is supported by
Professor
the
Azizur
bedside
Rahman
knowledge.
Sahab, this league is a stimulus for our and junior doctors to study and correlate their clinical practices with theory, you see. So I think you pointed very rightly that they should spend more time with the patient than on the Google or on the book. So Patient is a very good book.
Thank you very much, sir, for your kind words. And I'll request Professor Kashif Ali Hashmi. I think he's there with us. Sir, your quick thoughts on the game so far.
I think it's a good battle between the two teams. Questions are probably straightforward and slightly tricky. This is, I think, good judge of brains and बाकी जो ऐसे आगे चलेगा तो इसकी मेरे ख्याल में ट्रांसमिशन बेहतर होगी और बाकी लोगों को सीखने का मौका भी मिलेगा इंशाल्लाह.
Right, sir. Thank you very much. I'll move to Professor Munir Azhar. I think he's there with us. No, he's not there. All right. So we have Professor Shabnam Munir. Is she there, madam? Are you there? Professor Shabnam Naveed. Ma'am, are you there?
There's a lot discussed from the Dr. Ishaq and Dr. Aziz and others. So I'll just say that this is a very great initiative for our postgraduates to learn. And it is really important to have a clinical correlation with theoretical knowledge. So this is one of the important things. Otherwise, I want to congratulate the AKU team for being successful, and I also want to cheer up for the runner-up. That basically competition and participation is the thing that should be on the top. Baki jeet haar to sab kuch ho hi rehti hai. Thank you.
Thank you very much, ma'am, for your comments. So the match is still on. We've just had the first innings, and
Yes.
Dominators, Jinnah Dominators from Jinnah Hospital, Lahore, they've put up a total, and the total is 24. And the second innings is going to be initiated very soon, where Aga Khan Titans, they'll have to come up with the odds more than 24 to win. So with this, I think we are now going to move towards the start of the second innings. So are we ready?
Yes, please.
All right. So can we have the second scenario on the screen, please? All right. And I will request Lahore Jinnah Dominators to read the scenario.
His clinical BP is 159 by 90. He lives a sedentary lifestyle. He is obese with a BMI of 32 and is a smoker. He was advised lifestyle modification and started on lisinopril 10 mg. After 1 week, his renal functions were done. The results are as follows. Urea 45 milligram per deciliter, baseline 35, and creat 1.25 milligram, baseline 1 milligram per deciliter.
All right, so Aga Khan Titans, are you ready?
Yes.
Okay, can we have the first question on the screen, please? First question. Read it, please. Jinnah.
What should be the next best step? Reduce the dose of lisinopril to 5 mg daily, stop lisinopril, continue at the same dose, start calcium channel blockers, and start beta blockers.
All right, you have 60 seconds to answer.
Option C. Continue at the same dose.
Are you sure? You've come down the wicket. You want to hit over extra cover for a 6. You want me to lock it? Option C.
Yes.
C Charlie. You want me to lock C Charlie, right?
Yes.
Okay. They are sure. Lock C Charlie. Oh yes. Sure they are. Well done. That's a 6. First one is going for a 6 for sure. Well done. Well played. All right. Question number 2 on your screen. Jinnah, read the question, please.
You advised weight reduction and dash diet for management of BP. Patient wants to know the exact effect of weight reduction on blood pressure. 2 to 4 mm of Hg for every 5 kg weight loss, 8 to 10 for every 10 kg, 5 to 20 for every 10 kg weight loss, and 15 to 30 for every 5 kg, 15 to 30 for every 10 kg weight loss.
And the timer starts now. So, Aga Khan Titans, we would request you to unmute the mics. We want to hear you discussing.
Okay. So option B. 8 to 10 millimeter of mercury for every 10 kg weight loss.
Are you sure about it? You want me to lock it?
Yes.
Let-
Yes.
Okay, they want us to lock B, beta. Let's see whether it goes for a 6 or not. Lock it. Oh, the pattern follows. You've missed it as well. This one came in and you missed it. All right, all right. Never mind. Question number 3 on your screen now. Dominators, read the question.
Come to medical OPD. A patient comes to medical OPD and complains of dry cough. All the possible causes were ruled out and cough was believed to be side effect of ACE inhibitors. It is mediated due to which of following chemicals? Increased level of histamine, increased level of serotonin, increased level of bradykinin, increased level of methacholine, and decreased level of bradykinin.
Your 60 seconds are on the screen.
Option C. Increased level of bradykinin.
Oh, that was very quick. They came down and they've smashed it. I don't know whether it's going to be caught or not. You want me to lock it? E epsilon?
Yes.
They're very sure about it.
It's increased
C.
level of bradykinin.
Okay,
Increased level
Charlie,
of
C
bradykinin.
Charlie, C Charlie, right? Okay. Lock C Charlie. Yes, and very well done. Very well played. You got this one right, and I can see this one going for a huge 6. Well played. Very well played. All right. They have now scored 12 runs. The score is 24 that is to be beaten. Question number 4 on your screen.
After a few weeks, the patient came to the emergency with an altered state of consciousness. BP was 220 by 180, pulse was 110 beats per minute, and what is the emergency treatment? Sublingual caputin 25 mg, IV hydralazine, IV nitroglycerin, IV labetalol, or oral methyl dopa.
Timer starts now. Aga Khan, unmute your mics.
IV. Sublingual capital भी नहीं दे सकते. CT में option D, intravenous labetalol.
Okay, so are you sure about it? Should I lock it?
Yes.
Okay, lock D delta. Yes, another 6. Very well done. Well played, Aga Khan. Titans, you surely are looking like Titans at the moment. Well, question number 5 on your screen.
Fundoscopy of the same patient showed grade 4 hypertension retinopathy. How much BP should be lowered in this patient? Normalization of BP in 1 hour, 25% reduction in 1 to 2 hour, 50% reduction in 1 to 2 hour, 75% reduction in 1 to 2 hour, below 180 by 110.
Start the timer, 60 seconds.
At 2 hours.
So normalization is one. Normalization. So, option B, 25% reduction in BP in 1 to 2 hours.
Okay, option B beta, right? You want me to lock B beta?
Yes, beta.
Okay, lock B beta. And that one is also going for another 6, a hat trick of 6s. Well done. Very well done. And with this, we have scores that are level now, 24 apiece. And you still have 5 more questions to go. Well played. Very well done, Aga Khan. So, question number 6 on your screen now.
After 6 months, the patient presented in ER with the complaint of severe headache, vomiting, and dizziness. Sign of meningeal irritation are present. BP is 180 by 120. What is the most appropriate step? Immediate lower BP followed by CT scan, lower BP followed by lumbar puncture, immediate CT brain, immediate MRI brain, immediate lumbar puncture.
All right, Aga Khan, are you ready now?
Yes.
Aga Khan. Okay, good.
लोअर बीपी नहीं करेंगे, लोअर बीपी नहीं करेंगे, मैं जो सीटी ब्रेन
Is this going to be the winning stroke? Let's see.
So option C, immediate CT brain.
You want me to lock option C, Charlie. Is that
Yes.
right? Okay.
Yes.
Then lock option C, Charlie. Yes! Well done. That is the winning stroke. Well done, well played. Now we definitely know who the winner of this match is. And now they've put up a score of 30. Well done. In 6 questions, they just got 1 wrong and all the others right. We still have 4 more questions to go. I think it's not about losing or winning. It's about knowing things. Knowledge is what it's all about. And we'll have the question number 7 on the screen now. Come on, Lahore.
CT brain shows intracerebral hemorrhage. What is the management regarding the blood pressure? Don't lower the BP below 160 systolic in first 2 hours. Lower BP to below 130 systolic. Lower BP to 110 by 70. Lower BP to 100 by 70 and lower BP to 140 systolic.
All right, the timer starts now. Approaching 30 seconds. Aga Khan, we can't hear you. Please unmute the mic.
So option B, lower BP to below 130 millimeter of mercury systolic.
All right, so you want me to lock option B beta.
Yes.
Okay, lock B beta. Oh, you got this one wrong. Never mind, never mind. So we'll have the next question, question number 8 on the screen. Dominators. Read the question, please.
If this patient has subarachnoid hemorrhage, what would be the most common site involved? Posterior communicating artery, interior communicating artery, middle cerebral artery, posterior cerebral artery, and posterior inferior cerebral artery.
Your 60 seconds are on the screen.
Option B, anterior communicating artery.
Okay, and the Titans want us to lock option B. Lock option B beta, please. Oh, you got this one wrong too. All right. Well, moving to the second last question. Question number 9 on your screen. Jinnah, read it, please.
After 1 week, a patient with the subarachnoid hemorrhage developed right arm weakness. What is the likely reason for this presentation? Extension of intracerebral bleed, new onset ischemic stroke, cerebral edema, cerebral vasospasm, obstructive hydrocephalus.
And the timer starts now.
Option D, cerebral vasospasm.
Are you sure about it? Because this one you're trying to heave over long off. Let's see whether it's a 6 or not. You want me to lock it? D delta.
Yes.
Okay. Lock D delta.
Yes.
And yes, it's a 6. Well done, well played. The score moves to 36 now. We already know the outcome. And now moving to the last question of the second innings. Question number 10. Read it, please. Jinnah, read it. Can you read the question, Jinnah?
What should be given to prevent this complication? Aspirin?
B option is labetalol, C is lipid lowering medication, D is nimodipine, E is intravenous steroids, and the timer starts now. 60 seconds.
D, nimodipine.
Oh, that was quick. You've come down the wicket and you're slicing it with an uppercutter going for a 6. Or not. We will know. I'm not sure. You want me to lock D, nimodipine?
Yes.
D delta nimodipine. Lock it, please. And yes, this one is going over point for a 6. Well played. Very well done. Well done, Aga Khan has scored 42 runs. Very well played. That's a wonderful performance, I think, and we know the outcome of this game now. In fact, for the last 3 questions we had known, so Aga Khan has won this match and they're going to move on. Well done, Aga Khan University, and commiserations for Jinnah Hospital Dominators. Well done, you did very well. I think there were a lot of glitches going on, but even then you stuck to the task. So it's all about winning and losing, but basically it's about taking a lot home and learning as we move on. And winning and losing is part of the game. We all lose some, we all win some every day. All right, so with this we move to the panel of experts and their highly esteemed and important views. We have Professor Ishaq Saab. Sir, your thoughts.
यहाँ जिन्ना डिनोमिनेटर्स से कम्युनिकेट कर रहे हैं आपसे
जी प्लीज
आपसे बात कर रही थी कि जो हमें टॉपिक्स डिस्ट्रीब्यूशन बताई थी उसमें न्यूरोलॉजी तो नहीं था टॉपिक में
ओके
तो हमारे जो सारे एमसीक्यूज थे वो सारे इस्केमिक सीवीए पे ही थे हमें जो टॉपिक्स बताए हुए थे वो कार्डियो मेटाबॉलिक से ही रिलेटेड थे
Okay, so I think
stroke is the outcome of cardiometabolic diseases, both hypertension and diabetes. So stroke is very much a medical issue and medicine. You can't isolate.
Sir, difficulty level is different for both teams.
No, I don't think that's. I won't accept that excuse or that comment. I'm not the paper setter, but I think stroke, heart attack, heart failure, kidney failure, these are the outcome of metabolic diseases. And cardiometabolic means diabetes and hypertension and its consequences. If you don't have these complications, diabetes and hypertension has got no significance. So I think stroke is very much a medical issue, a medicine problem, and it's becoming more of cardiology now. So I don't think that is a valid objection. I will value the comments from Professor Azizur Rahman.
Yes, I think I'll now move to the rest of the council. We have Professor Azizur Rahman Saab. Sir, your thoughts on the concerns? Do we have Professor Azizur Rahman Saab?
And moreover, it would have gone easily to the other side.
No. I 100% endorse Professor Saad's opinion.
Right, sir. And your thoughts on this match? So far, I think we know the outcome now. Aga Khan has won the match.
Yes, I think it's going very well and it's very, very fair match.
Thank you very much, sir. I think our competitors and I think these young students and residents, it's a learning phase for everyone. And I think we all always teach them to voice their concerns, but I do believe that it's a consequence of cardiometabolic issues and the overall realm is quite large. So since we get to face the music, once these things are not corrected, then we in the cath labs have to sort these out. We have to fix those. So we always say prevention is better than cure. And we should never let them get to that position where they have to cure things. So very rightly pointed out, and thank you for your comments. And we do have the other umpire for today's game, General Tasawwur. Sir, are you there?
Okay. No, I am unmuted. So I think it has been a fair game. There's always someone winning and someone losing. It's all right. I don't think we should take it too seriously for that matter. It's very good to participate actually. And of course, we have all learned from this and it has been an excellent session, I think.
Thank you very much, sir, for your very, I think, important points. And we have always learned a lot from you. You have many students all across Pakistan. It's great to have you here with us. And I think these are pearls of wisdom coming from the man himself. And we have Professor Kashif Ali Hashmi Saab. Sir, your thoughts?
I think it's a good match, and I congratulate our team for winning this contest. And I agree with Professor Ishaq's comment. Stroke is a part and parcel of cardiometabolic disease and should be asked.
Thank you very much, sir, for your extremely important words.
Can I just
sir, sure.
make 2 points? First is we don't use the term loser and winner. One team is doing better than the other one, you see. So I don't think they should feel that they have lost. They have done less better than the other team, you see. So one team is doing better than the other one, and we call them whether winner or loser. So I don't think nobody is loser, everybody is winner. Learning knowledge and disseminating knowledge is not a losing battle, it's a winning battle. And learning should continue, they should not get depressed. Second
Very right.
observation I would share
Very
with
right,
my
sir.
distinguished colleagues is that on both sides it was the female gender today. Both the teams were female, and I think cardiology is becoming a specialty of females gradually, and then we should find some job in gynecology and obstetrics. So I think it's both encouraging to see more and more uh, females coming to the specialty. They are more gentle, more caring, perhaps than we are. So I think in future when we have any cardiometabolic problem, we'll be very safe and very gentle hands. Thank you
Very
very
right,
much.
sir. I think important points.
Sorry
You
to
still
interrupt
have
you,
the
sir.
eye to pick things, and you're very right. We had the women power, in fact, the girl power today, and they've done very well. So cardiology, medicine, I think it's all about getting right out there and helping the patients. We have medical specialists, inshallah, very soon we'll have them out. We'll have super specialists coming out.
Hello.
So,
Sorry to interrupt, but we would like to raise a query.
yes, who's this? Who's this?
AQS Titans.
Yes, sure.
So, sir, we wanted to ask that in question 2, we had a query that
Yes.
usually, as far as we have read that there is 1 millimeter fall of mercury with every 1 kg loss of weight. So, in that question, I think there was some problem. Or is there anything that we can learn from this question?
Okay, so I'll ask the umpires to give the feedback on is question number 2, that is, right? We have Professor Aziz. Sir, are you there? I think we had Professor Aziz
I think
Rahman.
the
He's the
normal
umpire.
practice, Hamza, the normal practice is if there's a dispute about a question,
Yes.
it goes back to the question setters.
Yes.
And usually they have got a reference to support their answer. So I think
Yes.
we shouldn't dig too much into the ground because there will be a reference available to support that particular answer. So
Yes,
I would
very right, sir. Very
suggest
right.
to my
I'm going to
colleagues
clarify
to
this
not
as well.
to raise the issue again and again.
Yes. Yes.
These figures are very close to each other and sometimes very difficult ones. But that's a question you see you have to answer.
Very right, sir. I think Dr. Ishaq Saab, he has explained it to you. So whenever you have a query, we do have the umpires. We can always take their help, and they are the ones who are going to give the verdict. But Ishaq Saab is very right that if you have such queries, then we have the reviewers, and these questions, what you have there, they are reviewed. They are made by a panel of experts, and then these are reviewed by our specialists and faculty members, and every question is referenced. So yes, this has been reviewed, but if you put it in the review, then the review panel is going to review it and they'll get back to you. So this is how it works. And with this, I think I'll move to Associate Professor Shabnam Naveed. Ma'am, are you there? If you could give us your thoughts on the game.
Yes, I'm here, and I think it's a fair match and a good match. And I want to congratulations both teams for their participation in this team. And hypertension and diabetes, these both diseases are the part of the cardiometabolic diseases, and obviously all the complications related to these diseases should be the part of any competition, like cardiometabolic competition. So I think it was a good learning activity for all the participants, and congratulations to the both teams. Thank you.
Thank you very much, ma'am, for your words. And with this, now we come to the end of the first match of this league, that is Cardiometabolic Premier League. And it was a wonderful game. Yes, we know that one team wins, the other team doesn't actually win, but they don't lose as well, because there is so much to take home. It's not only them who are learning. We have learned from our Pakistan Cardiac Super League that all the faculty members, I as a moderator, in fact, we all learn a lot. So when we have so much going on, so much to take home from, I think this is where the victory lies for each and every one of us. And I think we had a wonderful game. So I want to thank our viewers, the guests and the panel members, and most of all the teams who participated in this match. And I think it was a wonderful game. I once again thank you all for your patience, your time with all the glitches. I think next time, hopefully, we'll have many more tough matches waiting for us, and the excitement is only going to increase. With this, we come to the end, and now it's my time to say goodbye to all of you. Allah Hafiz, till next time.